Hey, Dr. Lindsey here. This is a 14-month update on a younger patient that came in and did a short interview. So about a year and a half ago, this young man and his mother came in to see me. And I like it when younger guys come with a parent because they're less likely to be sold by me or a salesperson, which we don't employ, something they don't need or it's not appropriate for them. So for all you younger guys, watch a bunch of our younger guy videos and you'll see in a number of them, the parents have actually come and been there for the consultation and the surgery and help the person make a better decision. You know, I realize that these young guys are adults and they can make decisions, but I have a 26-year-old and a 23-year-old, and from personal experience, they don't always make good decisions. And so it's oftentimes good to have somebody with a little bit more worldly experience help a younger patient make a decision which will impact them for the rest of their lives. Plus, this kid has a finite amount of hair on the back of his head and a family history that would suggest he's going to need at least 2 hair transplants. So I had him come back for his pre-op, again with his parent, and make sure that everybody really understood everything. And they had to travel here from a couple hours away. And so we did 2,300 grafts on this man. He stayed up here for a few days, so we cleaned him, and then he went back to his area. And we saw him in a month for a scar follow-up, which was unremarkable. And then I didn't see him again until 14 months when he walked in. And he's a fellow that has fine hair and really had no hair up front, and we had to design a hairline that would age well. So he did this video. Okay, Steve, you're 24, is that right?
24. Yeah.
And my son turned 26 today. And so I'm used to dealing with people in your age bracket that sometimes make good and bad decisions. And I think when I met you, about 18 months ago, we talked about, planning for the future and doing a hairline that would look okay when you're 59 like I am, not a perfect hairline for a 24-year-old. And so we did you 14 months ago, essentially this week or so. And you live a couple hours away. And so I haven't seen this really since right after we took your stitches out. You've sent me a few pictures. Your before pictures will be up and to one side of your head. You were telling me a moment ago that you didn't tell anybody. Tell me, and then you told me kind of the story.
Well, so I told some of my family, I told my friends, but I wanted to keep it a secret from some people to see their reaction to it, because I was looking for it, but I wanted to see if just the average person who would notice, the change in my head, my hair, and I'd say no one really said anything until about 7-8 months, and then people, they couldn't put their finger on it, but they were like, "Oh, you're doing something different with your hair. It looks great. It looks great." And then I just out and told them that I had a hair transplant or whatever, and they.
And we had talked before, and we just spoke a minute ago. You're a young fellow that we did. What did we do? 2,400 grafts? Is that what we did?
Yeah, about that.
And at some point, I think you're going to need a second case a little farther behind what we first did, and I would advise you to add a few hundred hairs to your hairline. There's no rush to do that on anybody, but particularly a 24-year-old. You should sleep on it and make sure that everything's cool. But you were really worried about the scar. Yeah. Here's a close-up of your scar. Has it been any problem at all?
No, sleeping on it is where they take the stitches out. You need a neck pillow, and that it's sore for a little bit, but I don't even remember that the scar is there anymore.
Yeah, and you got a pretty short haircut. Yeah. Any kind of bullshit I pulled on you?
Nothing.
Okay, and I don't think I met your parents. Did I meet your parents?
You met my mom.
I met your mom. Because I usually make all you young guys, younger than my son, bring a parent so that you don't do something stupid. Yeah. Any advice you have for people that are looking at this?
Yeah, I would say, before I did it, I was scared. I didn't know what was going to happen. There's a lot of stuff, information out there and stuff. But I will say that I had one goal when I came into this, and that's to be able to look in the mirror and not be reminded that I'm going bald every day. And here we are a year later, and I accomplished that goal. And I would just tell people, if they're thinking about getting a hair transplant, the most important thing is where you get it at. It's not whether or not you do it or not, it's if you decide to do it, where you get it. And doing it here is a great option. I'm sure there's a lot of great options, but I'm glad that I did it, and I'm glad that I did it here.
I appreciate your kind words and your business. It's okay to use your face and everything in my YouTube video, right?
Yeah.
Okay, thanks a lot, man. So in summary, so we definitely do hair transplants on younger guys. the key is that they have to understand, as do our older patients, that oftentimes you're going to need more than one hair transplant. Particularly younger guys, if we do the front and you've got a bad family history, well, you're going to be doing a second case and maybe a third case after that. So before you start down this road, make sure you understand that. And that's where oftentimes a parent or even just a friend can help somebody understand that, because you've already been to 2 different clinics where some attractive sales girl said, we'll take care of this, we'll thicken it up, you'll never have to worry. That is not true. You need to plan and do this correctly. And the other point on this young man is his scar. He's got a great scar. Our typical scar is about 1.1 millimeters, like this part of my glasses. And it's easily concealed. And so he's far better off planning for the future with a relatively conservative hairline and good coverage and saving hair for the future, which he'll need, and getting a good scar rather than doing 1,000 or 2,000 FUEs, really tearing up his donor area and getting sparse coverage. I've got plenty of videos on younger guys. If you're a younger patient, you should watch several of them before you go anywhere. And if you're a younger patient, feel free to bring a parent or 2. We'll be glad to help you. Thank you.